We separate the fact from the fiction in our KSAT Q&A, and on every Wednesday, we are pleased to be joined by San Antonio Mayor Ron Nirenberg. And, the mayor's not, a stranger to making news, but yesterday we found out that you are self-quarantining for at least 14 days because you came in contact with somebody who is COVID-19 positive. You took a test, you came back negative. How are you doing, and what is the process from here on out with you working from home, staying at home, quarantining?
Yeah, well, thank you, Steve. And I also want to thank folks that have reached out and shown care. I really appreciate that. Obviously, this disease is not to be taken for granted. It's taken too many of our neighbors and friends and loved ones. So I was exposed to someone for a long enough duration that I'm considered a contact to a case. So I took a test, an asymptomatic test, fairly immediately early on that showed negative. Now, the tricky part is if I'm pre-symptomatic, it means that it won't pick up that on a test. So it's very important that a contact of a case quarantines, even if they're negative and they're not showing symptoms, because symptoms may arise at any given time during the incubation period, which is 14 days. So the public health guidance, I've talked to Dr. Wu and Dr. Bridger. What a contact needs to do is quarantine for that 14-day period. And so hopefully it was nothing long. It was a brief encounter, but hopefully, again, nothing was picked up. But it's important that in case I become symptomatic, that I don't, in that period of time, infect other people. So I'm quarantined.
We didn't get an official update from the city due to the Veterans Day holiday today. Can you kind of brief us on what's the latest?
Yeah, well, we are definitely seeing a rise in cases. It's a hill, not a mountain, which is a good thing. So the first thing I ask our public health folks when we see an increase in cases that is a little abnormal is that, are we getting through all of our case investigations? And the answer is yes. So that's really important. We're getting to people who are infected to let them know so they can begin to lock themselves in place and also reach their contacts to ensure that they're doing what I'm doing, which is remove themselves in case they become infectious. That's all happening, and that's been very good because we're able to slow down the infection. The other thing that's happening is people are getting tested, and we're getting those test results back faster. So we're able to isolate this infection faster, which is slowing down the rate of increase. So we're seeing an increase, though, and that's why we have to buckle down. We've seen another increase today in our hospital numbers. I think we had about a 20% increase in the hospital census. Our numbers of El Paso patients is flat tonight. We have 59 patients from El Paso in tonight. We actually had a decrease from 61 yesterday. So everything is starting to tick up. We're not seeing that great exponential increase, which is very good news for San Antonio and says that we have the ability to control this if everyone does their part.
How concerned are you, though, when you look at the trends? I mean, Texas, the first state to pass 1 million confirmed cases. When you're seeing, the number of cases per day set new records, how concerned are you that we're going to start seeing that trend accelerate in San Antonio and Bexar County?
I think we have to be vigilant. I am concerned if people start letting their guard down too much, that we will start to see that rise. I'm concerned about the politicking that's happening. We still don't have a uniform approach from the federal level or even the state level, and that's why Texas, unfortunately, now is the leader in cases. But what you see happening here in San Antonio, and the great cooperation of the community, and the mask wearing that people are adhering to out in the public, it's all helping. It's all slowing this down. We're starting to see a tremendous increase in Dallas as well as in El Paso. All the big cities are starting to buckle down again. So we have the ability to control this. We have to stay vigilant. I'm concerned if we don't do that. But so far, people have been really doing their part, and for good reason. We've seen too much illness and death in our community already.
You mentioned some of those other major Texas cities that are seeing higher case numbers than we are here in San Antonio. And speaking of that trend, where do you think San Antonio is right now? What is your assessment of where we are locally and where we're headed?
I think we're starting to get on that hill again. I would say that our numbers are increasing, but they're relatively stable. Where we don't want to go is to see that R0 value, the number of people that are infected by a single case, is still right around 1, which is good. That means that the cases won't start to explode if that remains the case. But that number, that statistic, is all dependent upon the behavior that people exhibit, particularly when they are symptomatic or when they feel like they're sick or they actually are sick with COVID. I think with respect to other cities in the state, we're in good shape. We are seeing not as much load in terms of case numbers per 100,000 residents. Our census numbers in the hospitals are relatively stable, although we're seeing an increase. They're relatively stable. And we have, from the very beginning of this pandemic, had a much better handle on the infection than most of the other big cities in the state and in the country, I would say. That continues. But it all depends on us, again, taking it very seriously. We are definitely not out of the woods. I know there's good news, potentially on the horizon with the vaccine. It's going to be some time until we have the vaccine in shape for distribution. So this is still a very serious disease that we've got to take enormous precautions for. And that is what we're doing. And that's just what we have to continue to do. Don't get tired of doing the right thing.
A couple of questions for you. I have heard anecdotally from people that they believe in San Antonio and Bexar County that a lot of the spread has to do with gatherings in the home, not necessarily, any other type things. If that is the case, and I'm curious if you've heard the same thing, if that is the case, how concerned are you about Thanksgiving on the horizon?
That is the case. I think more than anecdotally, we're starting to see that. And I am concerned by that because we're right around the holidays, and it's the family and friends that we are around a lot that may one member of the family may have been somewhere a week prior, and we just take all that for granted. That can ultimately lead to an infection. That's the part that is concerning. We tend to let our guard down around people that we hang around with a lot, and that's where the danger is. So people, again, just have to recognize that for this holiday season, it's going to be a little bit different. It's going to be a little uncomfortable, but let's show the love that we have for one another by keeping each other safe from this disease. And we can see the light at the end of the tunnel. We see, again, the therapeutics and the vaccines on the horizon. We are also seeing, again, our ability to control this great exponential surge that we saw in the summer. So things are working. Just stay the course. Be persistent with the guidance of the public health professionals.
Mayor Ron Nirenberg, best wishes, prayers to you and to your family. Thank you so much for your time.
And all of us. Thank you very much.
I think maybe we can call this quarantine cam. KSAT quarantine cam. Can we call that from now on? I'm just kidding. Mr. Mayor, thank you.
For a few days.
Yeah, Mr. Mayor, thank you for your time as always. We'll be right back.